Welcome back to the Science of Turning Back Time, where we explore the science and strategies that help us extend our health span, not just our lifespan. Today, I'm joined by Dhara Pannick, a London-based GP with over a decade of experience in both general practice and acute hospital medicine. Dr. Pannick brings a uniquely holistic approach to healthcare, combining medical precision with deep compassion and a focus on prevention. And as part of the pioneering team at Ezra, she helps patients make sense of advanced multi-organ MRI scans, translating complex radiology findings into clear, reassuring, and actionable insights. In this episode, we'll explore how early detection can transform lives and the role of AI in advancing medical imaging, and why proactive health is the future of medicine. So welcome today. Really pleased to have you here with us on the show.
Thanks so much. Pleased to be here.
So tell me a little bit, your mission at Ezra is all about prevention and early detection. What inspired you to dedicate your work to this, and what's, keeps you passionate about it?
I'd start off by saying 50% of us all have cancer in our life, which is quite a scary number. And so for me, as a doctor who's interested in longevity, interested in optimizing health span as well as lifespan, it was a kind of natural progression in my career. Ezra specifically, because we know that early detection is the key to optimizing your health and lifespan. We know that cancers detected early, disease detected early, gives you, often up to an 80% chance of survival compared to very, very slim chances, 20% and below. But that's where I'd say it was a sort of natural interest.
It's a very, very staggering statistic, isn't it? So 1 in 2 people will end up with cancer at some point in their life.
Yeah, exactly. I mean, we all know someone who's sadly had cancer, or people who, some of us have had cancer, and it's no longer this rare thing that can happen to someone else. It's quite close to home. Actually, my first Ezra scan that I reported on, the lady who was this wonderful 71-year-old lady whose son had bought her the scan as a gift, almost. She had no symptoms. She was completely well. She was diagnosed with a kidney cancer and fortunately has now had it removed. She was so grateful just to have had the scan. She would never, ever have had this found, really. And it would have been too late by the time it presented itself.
These stories are very powerful because, like you say, often people wait for things to go wrong before they go and investigate. So would you say this is something that people would do more proactively and more preventatively rather than when they have symptoms?
Generally speaking, I think the way that the UK is moving, hopefully, is towards more proactive healthcare in general. And I think that I strongly believe, and a lot of my patients strongly believe, that they want to take charge of their own health. And taking charge of your own health starts from knowing what's going on with you. And you need to know what's going on inside your body. You can't kind of wait for symptoms. You can't wait for signs. Often when you do have signs and symptoms of disease, it's often quite late in the process to do something about it, to fix it. So really, longevity is something that can't really be achieved without early detection.
I agree completely with that. So tell us a little bit about what it is that you guys do.
Great. So, Ezra is a body MRI scan. It scans from the head down to the groin. We specifically do target 13 organs for cancer detection. So all the algorithms, everything has been based around cancer detection, but we can detect up to 500 plus different diseases as well, like fatty liver or degenerative discs in the spine, or other very fixable health issues. I mean, I even had a woman, I can say, in her 30s who had these changes in her brain, which, if left untreated, if she didn't address the kind of changes and make the changes to her lifestyle, she would have probably gone on to, in later life, develop dementia. And actually, even though she's quite, you would assume, quite a fit person, taking care of her health and diet and so on and so forth, actually there were changes that even someone like her could make to improve her cardiovascular risk. And these are the kind of more subtle things that we can pick up. So the scan is, in a nutshell, a 60-minute scan, often less. So we have a scan available in London that's under 30 minutes. The reason that we can have the scan time so short is because AI technology is used to make the images more sharper, to reduce what we call noise, where previously, to get your brain down, your spine, your neck, all your internal organs, your liver, kidneys, gallbladder, pancreas scanned, you'd spend hours in the scanner. And, that's something people still did, but it's not really a cost-effective or time-effective way to screen. So with the use of the AI, that's come right down to, sub 30 minutes.
That's quite incredible, actually. And I know for some people it can feel a little claustrophobic as well. So the thought of spending
I'm one of them.
long time in there can be quite challenging. So having those times reduced is amazing. So tell me a little bit. I mean, going back to that story of the brain. So this is where we're not just thinking about cancer with these scans. But obviously, as you say, detecting a lot of metabolic disorders and a whole lot of things. Brain health is one that we're incredibly interested in as well, because, again, the statistics on things like dementia is really awful in the UK. And actually, we do know that statistics now show that nearly up to 80% of cases can be prevented. So I guess having that kind of information early on is also very helpful. It helps people, just focus where they're going to put their attention and energy when it comes to prevention.
So absolutely. I mean, I have to support people, have supported people going through dementia. And actually, dementia in particular is terrifying, because often the individual is not the one, although you think of, I don't want to have dementia, actually it's the people around you that are the most impacted. It's your loved ones that will be most impacted from the condition. And when people think, I don't want to have dementia, often the reasons are because I don't want someone to have to care for me, I don't want to lose control, so on and so forth. But going back to the MRIs and how they can help. I mean, look, the MRIs aren't designed to check for dementia, but they do often show things that can predispose people to getting dementia later in life. And if anything, gives you some clue into what you can do, a change you can make to reduce that risk. It's absolutely worth doing. It's absolutely worth taking. And I haven't had one person who's had an Ezra scan regret having one.
Absolutely, even if it's just for reassurance.
Actually, most people come to us for reassurance. Most people want to know what's going on inside them and want to be reassured. People don't really want to have a positive finding, obviously. And it's great that we're able to reassure so many people, but at the same time, we're able to inform many people too about things that actually they need to monitor and things that they may need, more serious findings that actually need actioning. And it doesn't, the serious findings haven't always been cancer, by the way. We've picked up severe fractures in the spine, kind of urgent spinal cord issues that, if left untreated, could predispose someone to having paralysis. We've picked up serious brain and body aneurysms, which is swelling of the blood vessel, that can lead to rupture and death, basically. So it's not just cancer. It's other things, and it's really great to be a part of a team whose mission is to make this affordable, accessible, quick, and to really have improvement in people's health span as well as lifespan.
So with you mentioning that, are these scans available to the public? Do they need a referral from a GP or a specialist, or are they able to self-refer?
So at the moment, it's all people signing up for themselves, and we've been in the UK for over 6 months now, which is really exciting. There's been a lot of interest. We've got busy centres. We're opening up more and more centres. We've got 5 new centres launching around the country in the next couple of weeks. We've got 2 fully operational centres, and one of our centres is an open MRI for people like us who are a little bit claustrophobic and who don't fancy having the process. That being said, most people who are claustrophobic haven't really, everyone's always come back to me, myself included, saying actually the team was so nice, and they gave the mirrored glasses, they put whatever music you like on, and a lot of people fall asleep. So it's not really been that big a concern. But we do have a waiting list, nevertheless, for the open MRI.
It's great, though, that people can self-refer. One of the things you said earlier on is allowing people to take charge of their health. And I think it's so important that people have control over their own bodies, really, and have an access to do these things for themselves, which is fantastic. So when people see their results for the first time, what are some of the insights or light bulb moments that often surprise or empower them?
So the way that the process works is you would go on the website, you would pick whatever package you wanted. So we've got a couple of packages available in the UK, one that scans from the body, neck, spine, all the abdominal and pelvic organs, and a cheaper scan that misses out the spine. Basically, that's the difference. And you pick which package you want, and then this is a really important part, because ultimately we're providing a medical service, and we collect medical information from people. So they do a questionnaire. They let us know if they have any metal work in the body. Obviously, that's really, really important to know. If they have a pacemaker or any stents or anything like that. And also if they are kind of if they've misunderstood, we feel, the kind of reason to have a scan, if they've got some symptoms and they're using this as an opportunity to diagnose, we'll pick that up, and we'll actually pick up the phone, or we'll send an email or have some correspondence and say, actually, this scan is designed for screening, and what you actually need is not this scan. You need to cancel your scan and go ahead and have this symptom investigated, and maybe come back to us in the future. And everyone really appreciates that, because we're very clinical. We're not just kind of the MRI. There's so many companies offering MRIs, and we're making sure that the right people are getting these. It's a screening test, and it's not for people with symptoms. That's a different kind of line of investigation they need to go down. So anyway, they go and have they do this medical questionnaire. I'll review it, or my colleagues will review it, and we will say, yes, you're safe to go ahead. No, you're not safe to go ahead. And then they'll go and have their scan, and then they will the scan will go to a radiologist who will use AI technology to help them. So it's not just an AI bot reporting from pictures. It is definitely a UK expert radiologist who is trained in interpreting whole body MRIs, who's analysing this with the assistance of AI to help them do this quickly, help them do it on a population level. And then we receive the radiologist report, And using a little bit of help from AI again, we translate this into language the patient can understand. So, for example, exophytic skin lesion, like actually a spot on your face. So just kind of breaking it down into what needs to be done. And actually, I think this is where Ezra is really separating itself from other providers, because that clinical and that human touch and the kind of medical excellence is maintained by not, by using experts in their field to make sure that people are receiving really good quality aftercare, as well as and advice, as well as good quality reporting.
So I think AI is really transforming radiography, and not just radiography, a lot of our medical detection. But yeah, tell us a little bit more about that and how that has, I guess, transformed the way in which MRIs are read.
So, great question. I think radiology and many other fields in medicine as a whole, is being transformed by AI. And with any kind of revolution, there is a concern about machines or artificial intelligence replacing reliable human output and human work. And what we're doing at Ezra, I feel like we're kind of taking the best of both. We're using AI where it's really good at picking up kind of subtle changes that perhaps the human eye may not see, and using expert radiologists who are trained and who are so familiar with interpreting images to effectively screen out the kind of noise from AI, and to make sure that they're reporting correctly and also not missing things thanks to the AI. So that's, I think it's quite an exciting mix.
Mm-hmm. And in terms of like true prevention, I'm kind of curious about the kind of, you mentioned there's a huge amount of things that you're looking for. What are some of the things that you may pick up that can be managed through lifestyle changes? Are there things that you can see in those scans that you can kind of just push people in a slightly different direction in terms of their longevity and health span?
Absolutely. And honestly, that's the best bit. My best conversations in terms of when we have follow-ups with people after their scan, first of all, I would say, how did it go? And everyone goes, oh, it's actually great, I fell asleep. And then going through the reports, there's so many little nuggets of information that you can take. So if you know that you have a desk job, and I see this all the time with some people, most people actually, who are in an office-based job, and the posture is off, and I immediately know if someone is doing really good Pilates or really good strength training, because they will have a good spine. And I know it when I ask the question that, what are you doing? Your spine looks amazing. And they say, well, I'll do Pilates 3 times a week, or I do strength training with my personal trainer, or I have a physio, whatever it is. And actually even telling them it's working because your spine is really good. That is such key information. And at the same time, on the flip side, saying to them, actually, your spine is showing quite a lot of wear and tear. You're in your 40s. You probably want to use this time to reverse those changes. You want to try to build in strength training, or having some sort of targeted physiotherapy to really build up your muscles to stop the wear and tear. And we know that strength training is probably one of the best, if not the best, and most evidence-based thing you can do for longevity. And it helps in all aspects of things that we're all concerned about, from dementia to frailty to everything in between, cancer. Every aspect of healthcare can be optimized. And also other things like indicators of poor lifestyle. The liver is obviously the one that springs to mind. We do detect fatty liver. It's not the scan of choice to detect fatty liver, but we pick it up. And when we pick it up, we tell people. And often it's not a surprise, because they know that they're drinking too much or overweight or whatever it is that they need to tweak or change about their lifestyle to improve the structure of their liver. And this is a reversible change. And we see people, in America, the company's been going for a few years now. So we've actually got this long kind of longitudinal data where people's liver has been scanned, found fatty liver, subsequent scans, no more fatty liver. And it's really, really nice to see that the changes people can make based on our findings is adding to their health span.
I think that's very empowering. It's incredibly empowering to, go through a process like that where you can have measurable data that shows the things you're doing is actually making a difference. I think it's very affirming for people, especially in terms of exercise or making these lifestyle changes, to be able to, see that impact happening at a deeper level within the body, which I think is probably one of the most powerful things about doing these kind of, tests. It's not so much, like you say, about even looking for cancer or anything like that. It's about really picking up on maybe some of the more subtle things that could potentially, lead to further problems 20, 30 years down the line. And, you mentioned frailty, but, if you can start earlier in life, kind of building muscle mass and maintaining muscle mass, these kind of things can end up having very different outcomes for people later on in life.
Absolutely. And, ultimately, the scan is designed for cancer and affects so many of us. 1 in 2 is actually a really shocking number. And it would be amazing if we could touch that number. It would be amazing if through our technology, we could normalize screening. We could normalize screening your body the way we normalize having routine blood tests, or we have normalized mammograms, or so on and so forth, and smear tests, and actually whole body MRI, I hope, will be the future, becoming more normalized.
Absolutely. So kind of, what do you see in the future? Like if you look at healthcare 10, 15 years from now, what's your vision for how that's going to look in the UK?
Well, I've got my own kind of what I would love. Like, I'll tell you what my master kind of plan, if I had control of the healthcare systems, would be. It would be you go in for your annual body MRI. You go in for your annual blood tests. You have a panel of kind of biomarkers and health testing done. You have your weight and height and blood pressure and everything checked. And then using AI technology, all of that information is bundled together. You are given a kind of a flag anywhere where if your liver tests are a bit funny and the liver scan looks a bit odd compared to the one last year, the AI would draw in that kind of trend change, because we know that AI is better than humans at pattern recognition. And then your doctor, who knows you, who knows about your life, who knows about everything that's going on with you, would receive that and receive those flags and be able to proactively say, hey, what's going on?
That.
What are you doing? What's changed? Let's fix that. Why are we waiting for people to have really, really serious a condition called ascites, which is basically a sign of liver failure, where your abdomen completely bloats out to check people's liver? Why are we there?
I love that
It would be
approach.
amazing to.
Yeah. I love that approach. And also, getting a baseline for people. I don't know what age you would start that at, but getting a baseline of what does your blood work look like? What is your, so that if anything changes, you start to get an idea of, hold on a second, things are looking a little different for you than they maybe did last year. Maybe we need to look into this a little more. But it's also a very different approach from what we see at the moment. And I think I know that our GPs are very, very burned out and overloaded. But often what I'll find with my patient groups as well is they'll go in, for instance, and be told, well, you're pre-diabetic. Don't worry about it. We'll just, monitor it. And then a year later, well, you're still pre-diabetic. Don't worry. We'll keep an eye on it. And then a year later, oh, you're a diabetic. And we missed that little window in which, turning things around would have been a little easier, and potentially, had a bigger impact on health. So I think just moving to this model of prevention makes so much sense.
Yeah, and I think it requires time and resource, and those are the two big things that we don't have in abundance. And one of the things I love about Ezra, the mission of the company is to make this accessible, which is why we open centres up around the country, because we want people to have access to an Ezra scanning facility near them. We want people America, they've got pretty much whole of America covered. We want to have it affordable. We want people to be able to afford this, or in some way to be incorporated into our lives, and that's definitely the overall mission. And my hope is that we will get there.
Mm-hmm.
And the scans in America used to be really, really, really expensive, in the 15, 20,000s. And now they start at $500, which is, as many people have said, cheaper than an iPhone.
Absolutely. Yeah. I mean, if you put it like that, for sure. And what are the costs in the UK to have a full scan?
So currently, don't quote me exactly, but currently I think the main scan, which is the scan from the head down to the groin, including the spine, is about just under £2,500. And then the scan which skips out the spine, so the cost saving is due to basically time in the scanner. The MRI machines are so expensive that the bulk of the cost is renting out that scanner time. So skipping the spine saves a lot of time, and it's about £1,000 cheaper. But I know for sure that there are lots of active efforts being made to drive that down. When that will be is dependent on a whole host of things that I don't know of, but I do know that we're very, very committed to driving it down and making it affordable.
It does sound
has been done
it does sound like a lot of money. But if you think about, what people spend on cars, or what they spend on a holiday, or even the loss of income, if you end up having to, lose a career or a job, you can't really, kind of difficult to put those kind of numbers in if you lose your job, or you lose income because you can't work, because of late detection as well. So I think it does, it is a lot of money, but it is also something that I think can save a lot further down the line as well.
I definitely agree I couldn't agree more. And I think that that's kind of circling back to the mindset of our population as a whole, and maybe the government, and so on and so forth, about prevention versus cure, and early detection versus waiting for signs and symptoms to develop. And we know for sure that actually treating cancer early is much, much cheaper. Forget everything else and the cost to humans. If you just look at the numbers, we know it's so much more expensive treating cancer late. And it's just how much are people willing to invest in their health. And it's such a tricky multifactorial answer about affordability, priority, and so on and so forth. And all we can do is just try and chip away at it.
Yeah.
Try and make it more affordable. Try and educate people.
I love that. I love the vision and the mission that you guys have to, bring this prevention in, but also really focusing on how do we make it accessible? How do we make it affordable as well? So it'll be interesting to see what happens over the next few years, and, be tracking that quite carefully. I think that'll be a really, really exciting one to keep an eye on. Dhara, this is a podcast about Healthspan. And so I'm really curious, what do you do for yourself? Are there things that you prioritize just for yourself in terms of health?
Yeah. So, I mean, I can talk about me. I can talk about my loved ones. I've done lots of things for myself. I mean, I'm interested in Healthspan from a clinical point of view. How can I educate myself? I'm doing some postgraduate education as well about sort of functional medicine and biomarkers and data about how kind of how I can provide my patients with the knowledge to say, actually, that supplement doesn't have any data, or that so on and so forth. And I also obviously use that for myself. So what I say I'm consistently doing is I consistently strength train and
Mm.
exercise, because hands down, that's the best thing you can do for yourself. And I'm a working mum of two. So I do have a busy life, and I get that there's not always time for exercise, and you've got so many priorities and school drop-offs and this and work meetings and here and there. But you absolutely have to prioritize your health, and if there's one thing you can do, strength training and exercise is so cardiovascular exercise, walking, running, whatever that may be, is the single most important thing you can do. And the example I often give to my patients is when they say they don't have time and life is too busy, is I say, if your child had a medical appointment and I said to you, you've got to take your child to this medical appointment twice a week, would you do it 3 times a week? And they said, yeah, of course. Would you move your meetings? Would you block out your calendar for that appointment? And the answer is always, yeah, I'll find the time. So I say, for your child, to be well for your child and for your family, find that time.
Mm-hmm.
And it really hits home.
I agree
Because I've had to tell
completely.
myself.
Yeah, I agree completely. And I think as women, we often, we put our families first and the needs of our kids. And, but it's so important to remember that, as a mom, if you are not 100% well and strong and there, the whole family is affected. And so, as selfish as it sounds, I always tell people, prioritize your health first. You put your own health always as number one. Because when you do that, you have the health and the capacity to really care for your family.
And I think capacity is really a good word here, because it really is. It's about when I didn't have the time, when I wasn't making kind of my wellness a priority, I wasn't doing as well in every single area. I wasn't as good a mum, I wasn't as good a doctor, or so on and so forth, because it's about energy, it's about fitness, it's about stamina, and it's about mental wellness. And you have to make time for it. Otherwise, like I say to some of my patients, if you don't make time for it, you have to make time to be sick, and you have to make time for illness.
I agree. And I think also just for yourself as a doctor, I would imagine that, doing all these things for yourself and creating that capacity means that you show up better for your patients. You show up in a completely different way than when you're burnt out and tired and you're like, oh, here's another patient I have to get through, and it's a completely different
Exactly.
experience meeting a doctor who meets you with compassion and they're present and their energies up. Yeah.
Absolutely. And it definitely, yeah, people can feel that for sure. Absolutely. The energy is, I believe in all of that sort of thing, energy and people's vibes and wavelengths. And another thing I did do a few years ago was Zoe. I don't know if you've heard of Zoe, but it's the kind of microbiome gut test. I mean, I didn't track anything necessarily, but I learned a lot from it, because I learned about eating, and I stopped eating processed foods, and I stopped giving my kids processed foods, because I started moving away from convenience to nutrition, and uh, trying to look for ways to make healthy meals, quick healthy meals, so that I wasn't, using having to use processed foods. Basically, I learned to make bread. I can't say that I do it all the time, but I now definitely am careful what kind of bread I buy. So I think little changes. And here's where, even my husband's had an MRI scan, because I do really genuinely believe in Ezra, and I really do genuinely believe in early detection, especially for people who have loved ones, a history of cancer and so on and so forth, and disease in their families. I think it's going to be more and more important to do these year on year, and blood tests and things like that.
Yeah, absolutely. And I also love that you're prioritizing natural food. It takes a little bit more work. And again, often people will quote, well, we don't really have time. It does take a little bit of additional work, but the benefits is huge. There's actually some really interesting studies on Healthspan and ultra processed foods as well. I can't remember the exact statistics, but I remember being quite shocked when I looked at just the impact that has got on long-term health.
Yeah, especially even kids. There's a big link between leukemia and in childhood and ultra processed food consumption. So that for me was a big kind of eye opener myself. I don't want your kids to be, in any way harmed. So that was a big kind of alarm bells to me about what I need to change about my life.
Mm-hmm. Fantastic. So, what's one thing that you tell all your patients? Kind of, what's the one thing that you would say to most people is one of the key things, takeaways for them? I get that it's very personalized, so for each person it'll be different.
Yeah,
But what would be, in terms of
I think
just
the overall,
one nugget for
yeah,
fan?
yeah. I think without sounding too, I don't know, cliche or generic, I think to take charge of your health, to really take ownership of your health. Your health isn't something that just happens to you. It's something that you can own. You can own the data. You can go out of your way to kind of break the traditional molds of what's available to kind of seek and proactively optimize your health. So tracking, um, whatever that involves, blood tests and MRIs and what you're eating and really doing the right things. But health shouldn't be an afterthought. It should be something that you are working towards, and it should be something that you take charge of. It becomes so normalized. Sometimes I say to my patients, do you think about brushing your teeth in the morning? Is that just is it something that you just obviously will do? And this is something that you just obviously should do, because it should be that normalized that you wouldn't leave the house without brushing your teeth usually. so you wouldn't not think about your health, and you wouldn't not think about how to optimize it.
Mm-hmm. I think, yeah, that's incredibly valuable. And it's kind of just switching that mindset around, isn't it? Switching it to allowing people to take charge, and also, in addition to what you said, not always handing over your health to experts. And of course, we need our doctors and our experts. But, having an element of taking charge or control of it as well. Like you said, the data, in the sense that you're not a passive participant in this. You're actually a really active part of your own health process, and not just handing over the responsibility to your doctors and to the experts around you.
We actually know that when people hand over, they're less likely to do what's been told to them. So we know that when people seek out and when people take control, they're more likely to do whatever the end result is. So if they want to go and have their liver checked, for example, and it shows X, then they're more likely to then act on it. So, it's a bit of an interesting one in terms of human psychology. Taking charge means you're more likely to action outcomes.
Absolutely. I agree. This has been a really, really great conversation. What we'll be doing is, in the links below, we'll put some details on how people can find out more. about Ezra and the MRI scans. I really appreciate your time today. Very, very grateful for a really lovely conversation. And thank you again for joining us.
Thank you so much. Lovely to speak to you.